What's up, everybody? So today I'm going to talk about my pediatric rotation of my third year. Let's get to it. So what did I do? So 5 weeks was the duration of my pediatric rotation. 2 weeks were inpatient, just general inpatient pediatrics. That could be anything from ICU to just consult pediatrics because they were kids. To outpatient, where I spent 2 weeks just in a general outpatient practice. Nothing special about that. And then I did 1 week of pediatric cardiology with a pediatric cardiologist. He was actually a cardiac surgeon who was just doing his office-based setting then. So for the inpatient portion, I would get there around 8 a.m. I would prepare on what patients I'd had. They only gave me like 1 or 2 patients, so it was really chill. What I did was, do a chart history, prepare to see the patient. Sometimes they wanted me to see the patient on my own, then present to the resident, and then we would do the walking rounds with the attending. Or other times, I didn't even have to go see the patient on my own. I just went with the resident, stood in the corner, watched the resident do whatever they wanted to do, and then did walking rounds with the attending. Or we would never see the patient, and we would just do table rounds, and I would maybe only see the patient just walking by the room. So like very different environment. Never knew what I was going to expect the day of while on inpatient, because the attendings were also changing every day. So there's no way to really gauge what was going on. For the outpatient side, again, I was with a different attending or NP or PA, whoever was on call that day or working in the office that day. I was with them. Typically, I would do a morning shift with a provider and then an afternoon shift with a provider, or sometimes they would give me a morning or afternoon off. That was a lot more provider dependent. Sometimes the provider wouldn't want me to see the patient on my own, so I would just go with them. Other times they treated me like I was an attending almost. They wanted me to see the patient, write a note, and figure out what I wanted to do, whether that be a prescription or a therapy of some sort. Tell them, put it in the notes, and then they would just co-sign it and walk in, say hi, I agree with Chase, and then move on. So very different environments. Again, no clue how to know what I was doing that day, but it was pretty cool. I mean, you feel like a doctor on those kind of days. And then the cardiology side, that was with one doctor for the whole week. That was the most intensive time. I was usually getting there about 8 a.m., but some days I wasn't leaving until 5 or 6 p.m. that night, and it was all just outpatient. That he would see kids and adults, which I thought was weird. So the first day I actually didn't see a single kid. I saw a bunch of like 30 to 40-year-old dudes, because this guy would see patients when they were a kid and then follow them forever. So being a pediatric cardiologist, he would see cardiac defects at birth, and then he would follow those patients for the duration of their life, and also do the operations if needed. So I was kind of seeing that perspective of what they do. I didn't choose pediatric cardiology. They just put me on a specialty, and it just happened to be cardiology. I thought that was really cool. Besides the 12-hour days or 10-hour days or however long they were, that was a little rough, especially in the outpatient setting. But that was what I did. So the shelf, I feel like the shelf, a lot of people say it's one of the hardest shelves there are. For me, I don't know why. I thought it was one of the easiest shelves I took. All I did to study was UWorld. I just did every UWorld question and then every missed question. I didn't read any resources. I didn't use any other online resources like Online MedEd. Didn't do any of that. I just did UWorld, and I wrote down my missed questions on a physical paper and then read them the night before, and that was actually my best shelf, even better than psychiatry, which is what I'm going into. So I felt like the shelf wasn't too difficult. It was not what you see in the office. I thought that was something that upperclassmen told me, is the test is not what you're going to see in office. So it's basically all like rare diseases and stuff like that. That's how I felt it was. You don't get a good feel of what the test is going to show based on what you saw in clinic. But what to do to prepare to be a well-balanced student and to really show off during your rotations. I felt like the attendings Love to ask about screening tests or when to give vaccines. I feel like they all kind of cared about that, so know those. And then be quick to look something up. I feel like over the 3rd year, I got really good at, they ask me a question, they turn around for 5 seconds, and I can, Google it or up-to-date it real fast and have the answer when they turn around. They love that. That's fine. That's what you do in the real practice. So get good at that. That's easy to do. But I wouldn't say, you need any special physical exam. Maybe have a couple, super cheesy jokes for the outpatient, or just be goofy. I think the attendings like that, and obviously the kids like that too. But if you have any questions, drop them down below and I'll respond to them. Or if you have any ideas for a video, just ask and I'll do it. See you next time.